off at the moment. Humble request that please keep your video and audio off for the time being, except when the interactive session will start. Yeah. So, good morning, everyone, and a very, very warm welcome to day 2 of Patient Safety Awareness Week. And Cygnia HealthCare, I am Thankam Gomez. I am the founder CEO. And me, along with my company, we are committed to patient safety. And thank you so much. And every year we try to do something which is useful and current for our nurses. And I am very, very happy and excited for today's session because this is designed for nurse leaders. And I'm very sure that since COVID came in, we have seen a sea change in the way that we manage our nurses. We had our own problems to start with even before COVID. Now this has become much worse. And I keep hearing this from many different levels of nurse leaders in my job from Cygnia HealthCare. So it's not getting better, it's getting worse. And I'm very sure all nurse leaders will agree that it's very, very tough time managing the staffing. You know, it has got multiple facets when you're getting into a staffing solution. It's not very simple, just about, understanding how many nurses we need. Maybe it is even more. So across the world, nurse leaders are trying out new things, out of box things, to ensure that they are able to recruit the right talent, retain the right talent, and ensure that, the talent that they have, they are able to deliver safe care and the best patient experience. Everybody wants the best from the nursing team. And managing the team becomes the responsibility of the nurse leader. It's very easy that you have 30, 40, 50, 500, 600, maybe thousands of nurses under you. And I can very well connect with you and feel for you that how difficult it is to make ends meet. So that's why today we are having this session to collaboratively think, that, what can be done with the current, situations that we have. So that's why I call this journey as in pursuit of patient safety. We have done these for the last 2 years, and we'll continue to do what is required to ensure that patient safety can be maintained. Because when a patient comes in, when our near and dear ones get into a hospital, that's what we need. Right? So before I introduce the today's expert to all of you, let me just request once again that please make sure that your audio video is left off so that it does not disturb the deliberations here. And as you listen to Dr. Viji, you can keep on sending your comments or questions in the chat box, and she will look into it, or I will help her to look into that. And it is going to be an interactive session. So let's do the best of the time that we got. We have 90 minutes, and a few minutes that I am taking away from here, we can extend if required. So ladies and gentlemen, it gives me immense pleasure to invite Dr. Viji George, Program Manager, Department of Clinical Excellence, Nursing Professional Practice, Texas Health Resources, Magnet Program Director of Texas Presbyterian Hospital, Plano, Texas, USA. Well, this beautiful lady, of course, an Indian, now settled in US for quite a long time. And right now, as I told you, she works in this multi-hospital Fortune 100 healthcare system in North Texas, USA. Dr. George Roman incorporates promotion of clinical and nursing excellence through evidence-based practice, nursing research, shared governance, professional practice. Now, all these words are very familiar to most of us. And while professional practice environment improvement. I mean, these are all things that every nurse leader would like to, think about and do something about, and professional development in the hospital system. Her doctorate in nursing practice is focused on nurse executive leadership, not on any clinical topic. So that is a double, blessing for all of us. So she has uh, deep dived into nursing leadership. So she is an EVP fellow, current fellow in Health Science Research Fellowship Program, and then she's also an alumni of Army Medical MN in India. She's gone from Army background from here, so she has got a lot of publications to her credit. So I'm not going to get to that. And also she's also become the Sigma's International Leadership Succession Committee member and Global Leadership Mentoring Community Manager. So she co-founded Indo-American Evidence-Based Practice Fellowship Academy through collaboration with Johns Hopkins Nursing. And she has a lot of awards to her credit, nurse excellence in leadership, visionary leader, etc., etc. So, ladies and gentlemen, it gives me immense pleasure now to invite Dr. Viji. And before going away, I want to invite you all on 17th when I spend 2 hours discussing the international patient safety goals. I've added the seventh one, reducing patient harm associated with clinical alarm system. So I'm going to keep it pretty basic and practical so that you know exactly what needs to be done to ensure safety in these domains. So thank you so much for being here. And now let me invite Dr. Viji to the audience here. We already have 120 people here. Dr. Viji, now I'll call you Viji. Thank you so much for taking time out and coming and discussing such an interesting topic. And probably this is one topic that every single leader is having 24/7, wondering what to do. So now over to you, and I'm going to keep my video muted, and please asking the participants to also to keep your audio video muted unless Dr. Viji will ask for you to put on the video while you are speaking. So that will come at a later time. So let us listen to Viji. Thank you so much, Viji. Once again, over to you.
Thank you so much. Thank you so much, Ms. Tangam Gomez, and thank you for this opportunity for me to be here on this great national platform to interact with so many like-minded leaders. And we all are in similar situation. This is a global problem, staffing challenges. So when we are going to think about some innovative ways to manage the staffing, this doesn't mean that it is a one-way track, that I got something or a magic wand to fix the problem. No. Collective thinking, collective interaction, together we will look into some of the issues that we all are facing in our profession, and not only in our profession, but global platform. So many industries are affected with staffing challenges, but one of the most affected is healthcare. And of course, healthcare's largest workforce is nurses. So the staffing challenges we are going to discuss here as nurses is staffing challenges that's concerning the nurses. So this is an interactive session. So please feel free whenever I'm asking or something for you to put in the chat. And sometimes, if possible, if we are able to, feel free to use your mic, and we will take some people in between to answer some questions. At the same time, we'll maintain the flow of this session that we are doing it in collaboration with Cygnia HealthCare. And I really thank the Cygnia HealthCare as well as Ms. Tangam for inviting me for this session, especially in honor of the Patient Safety Awareness Week. So coming to the problem that we have in hand, before going into those details, my disclosure is that I do not have any conflict of interest. Anything that I'm going to share here is basically based on my experience as well as learned material from the reading, and also interacting with a lot of healthcare leaders across the care continuum, not here only in the US, but through Sigma and through Indian associations, interacting with so many leaders. Because as I mentioned, this is a global challenge and we all are in this together. So we'll find some ways to learn and think out of box for some of the ideas. An ideal team, as leaders, we all look into is having a what we call as a rara team. Like everyone is working so great. There is great team spirit. There is we're making profit, and there's innovation, motivation, engagement, and that graph is continuously going up, yielding to a productive outcome, great outcomes, right? That is what we all dream for. But the dream is not all the time the reality. And we know that's not the case always. We may have those ups and downs. We may see some kind of progress, but something else has hit. And healthcare is non-stop challenging. So despite our dream to have that, the thing that comes and faces us is the challenge. When I think of the word challenge, it actually excites me because a challenge is an opportunity to learn and grow. If we were not faced with a challenge, we will never be growing, we'll be stagnant. I hope you agree with this. But a challenge is only good as much as we can manage. If it gets overwhelming, then that becomes a problem too. It starts, we start overcompensating, we start working in the opposite direction. So one of the challenges that we are facing in our current time is the staffing challenge. And basically that's what we are here for. I would like you all to put, and feel free to even put your name from where you are or what your title is, that way I'll know what our audience is basically of. And I do know that a lot of you are in leadership and also working with leaders, or maybe in committees or groups, trying to seek some kind of solution for staffing problems that we all are facing. But please put in the chat, what is your burning problem? What is those few words that come to your mind when you think of staffing challenge? What is that one thing that comes to your mind? I see Juliet is from Apollo Mail. She's a director of nursing. So Juliet, what is your challenge in staffing? Never-ending saga. Definitely it's a never-ending saga. Tell me some of the words that pops up in your mind when you think about scheduling, staffing, or filling next 12 shifts. Anything that you're planning around that. I hope we have more people there. I see Rahel is raising hands. Is that you want to say something, Rahel? Staffing, yes, I see that someone is saying staffing. Skill set, expectation mismatch, yes, definitely. Thank you, Anjali, for that. Staff turnover, yes, it's a big word that we like. Turnover rate is always lack of competent staff, yes. Anyone else has got any more innovative or the words that is just staring at you? And so I see some more people are putting their things in the staff absconding. Wow, that's something that I never thought of. Absconding, more attrition, staff competence matching the patient expectation, shortage of staff. So it looks like basically we all are bombarded with shortage of staff. And some of the words that you frequently hear is, these are the words, like overwhelming, the retention piece, incompetent staff, patient staff, nurse ratio, someone has put there. It's challenging, core staffing, retention, turnover, crisis. The word that pops up to me is a crisis. It's definitely is crisis. We are heading like this towards the future. We are not going to sustain long the way that we are doing our staffing right now, or the way the staffing looks in the healthcare. On top of that, if you've seen this word art that I created in the form of the virus, the coronavirus, that kind of on everything else have impacted. As such, even before the pandemic, we were having the problem of staffing challenges. We all knew that. But this has compounded the problem of staffing challenge, I think, maybe almost double to what we were facing before. So I hope you all have heard some of these. The workforce is struggling with some of these things. And these are the words that we're constantly struggling to achieve high productivity, and the patient's acuity is going out. And we are constantly struggling to keep up with the staff that is required to give quality care. How many of you can feel what she is feeling when you are looking into your administration or management of your healthcare or your department? I feel like many of you are like this administrator who is here, and let me presume she's a nurse administrator and holding the, that, look at her expression. That's exactly, I feel like a lot of us are feeling the pressure of when we think about staffing. Can you put some of the feeling that your personal feeling around staffing? Can you put a word to your feeling when you have to deal with staffing shortage? What comes to your mind? Come on, this is an interactive session. Remember, you have to help me to get to the right content. This will be very driven to what you all want. Yes, stressful, documentation takes more time. Documentation burden is a reality. It is. The technology is out there, but it has made us to work more. Yes. But that's not a feeling though, right? That's a challenge. What is a feeling that comes to? Yes, anxiety, exactly. Stress, anxiety, disturbed peace of mind. Frustrated, depressed. You got it. You got it. Like, you feel anger. I love that. I love that. These are exactly some of the feelings. Look at that. It's like a magic I put it there, right? This is not me, but this is exactly all that negative feelings we can experience, we are experiencing as healthcare leaders around staffing challenge. So we are all the time overwhelmed. I feel the joy that initially we had getting into nursing, that feeling of helping people, helping a profession, coming to a service-minded profession. We are affected because of all this staffing shortage. A lot of nurses tell me that they don't feel like going to work. Many are thinking of early retirement, but some are just hanging in there because they need the money. So it has become kind of like, it's not meaningful or joyful for many. Managing duty rota or the schedule, helpless. I see that helpless word in this word too. But here I use the figure of a balloon. Like these feelings, if it is going to get inside us, it can take or it can burst. This can burst out of us. These feelings can become so overwhelming that a time will come that you won't be having enough people who are working with the quality or the safety that we have in our mind when we are taking care of the patient. But as rightly put by Ms. Thangas in the flyer, that remember that you're not alone. We are not alone in this situation. This is a global situation. Everyone is facing this problem, and we can do something to work together. But also remember, whenever there is a challenge, there is a hope too. I truly believe in the word hope, not only in the word hope, that we are looking forward to it, something, that to attain. That's why we are here today. Like, that's why I'm sitting here around midnight of my time. That's why you all are joining. And I see the passion, still more people are joining because we all are passionate to find a solution to this. Now, hope, I want to see this verbiage out here. This is a great quote that I got it to see that the word hope has got two connotations. It's not like being optimistic. Optimistic is a positive, it's like a dream that you're looking or hoping for, whereas a hope is a word with an action to it. Hope has two beautiful daughters. Their names are anger and courage. Anger are the ways things are, and that's exactly someone mentioned in the chat too, like, you feel that anger inside you, but courage to see that they do not remain as they are. So that's courage that will help us to sustain with the problem that we are having. So that's where we want to see into getting into that, how hope is a great leadership value that we can look into together to find some kind of solution to this problem we have. So hope is, it's like, as I mentioned, that it is a belief in action, that you're trying to find something positive. So we can categorize these people into like low hope people and high hope people. Last year, I took a course from John Maxwell on leadership, and that was on the leadership tables and leadership values. So it was over the 6 weeks time, and each week we were focusing on one leadership value, and the first and foremost was the hope. So this is an excerpt from there. So the low hope people are the ones who are always avoiding that problem, and they're fearful, get tired. They are not looking into making an impact or a change. Whereas the high hope people, and we all who all are here, I truly believe are the high hope people, are the one who are engaged in the problem solving. We are focused on the solution. What can we do to improve that problem? And we feed our faith. We are not like feeding the fear, and getting inspired from each other, learning some of the best practices for us to work together to find a solution. So those are, with that thing in the mind, there is some hope. I want to proceed further using some of the terminologies here. These are some of the terms that comes to us when we talk about staffing. Who can put it in the chat or unmute and tell me, what do you understand by acuity? We'll just go over some of these terms but I know that we have different levels of leaders here, entry level to the senior leaders, even executive level leaders, and maybe some CNOs too. So most of you may be aware of this, but to the entry level as well as mid-level nurse leaders who are not used to, or they have heard it but do not understand these terms, I would like to just briefly address these terms. I like the word level of criticality. Exactly. Acuity is how much a person is critical, what kind of a critical or acute care that person needs. If they require intensive care, they go to ICU. So for example, in a unit that usually you get 3 patients, there is because of the high acuity, more attention is required for his care. Here you are going to assign 1-to-1 ratio. So that sometimes disturbs our staffing, right? What is the productivity? What do you understand by productivity? Why do we need to know the word productivity when we are managing staffing? Patient assignment based on patient's condition, yes. That's for the acuity, yes. Productivity is something that we are using our resources in a right manner, so that the staffing, it's not that you're using all the resources to for example, sometimes the patients are less and you're keeping more staff, so they are not productive, so they are going to incur more cost to the organization. Efficient. I like that word, efficient. Yes, efficiently managing your resources, be your patient, be your equipment or other supplies. Their value for money is another word I see there. What do you understand by throughput? Throughput. Have you heard that word throughput? Here we hear that all the time. We have got even throughput committees in the ER. Because the ER or casualties, that's what we call in India a lot, is flooded with a lot of patients, and unless they have a room to get admitted, the ER will get crowded. So to the pipeline to remove the clog, we have to make sure that patients are moving from one place to another efficiently, timely manner, and using the best resources we have for them to get the right care they require. For example, a patient who comes with chest pain needs to go into the ICU, but if there is no bed in the ICU, where is he going to end up? He's going to take one bed in the ER. So if anyone else is coming, says there is an emergency, there is an accident, more patients are coming, are we able to look at that patient now? So throughput is something that we use the term that efficient movement of the patients happening, discharges are happening on time. Sometimes I have seen, early in my career, I have seen that discharges were to be done, but sometimes nurses delayed, because if I'm going to discharge my patient, I'm going to get a new admission, and new admission is going to, is a lot of work again. So how are we affecting? If you are not discharging, there is not a bed for the patient to get admitted. So a lot of things go into it. What do you understand by attrition? Have you thought of attrition? Attrition is when staff is leaving. Exactly. I see Ranju searching as a departure of employee all the time. Like, it can happen. A lot of the attrition is like from the organization for any reason. It could be a voluntary reason or involuntary reason, and for retirement, like we all eventually will retire from the professional arena of our work. So some kind of, the departure of the employees are expected. But then what is turnover? Like the word turnover, we hear a lot. Anyone knows about the turnover, the one that we are using a lot, and we are calculating it all the way at time to see how our staffing is affected? Separation from the unit. So turnover is the number of staff leaving for whatever reason in a month's time, divided by the number of staff around that time. The total employees there multiplied by 100 will give it to us. It's the in and out of people moving. And a good number for turnover rate to be is that 10% or less. So 10 to 14 is also okay, fine, but 15, 20, more than that, or this, like, we need to look into what is the problem. Like there is something more we'll go into turnover. Retention. What is retention? And how does, I see Jyoti Clara wrote that 10 to 13%. Yes, that's a good range too. So 40% and above, wow, that's a big problem. That is that a national number, that 40% and above? I will go to some of the facts here about other percentages here. Retention is the word that we use for keeping the staff in our unit. What retention does is that the longer a person stays in a position, role, or a place, the better team spirit, the staff have better job satisfaction, efficiencies, not because you have that experience, you become an expert in that area. So that's why retention rates are very important. 50% in many hospitals annually. That is about, I believe that you're talking about is the turnover rate. That's kind of like the crisis that we all are looking into, that we are facing. Is yes, that's a reality. That's a reality of some of these things that's happening. Have you heard the word core staffing? Do you use that word core staffing? Some of those staffing who are in those weeds of the staffing, have you heard the word core staffing? We use core staffing here a lot. The core staffing is a full-time equivalent, or the FTE, or the full-time staff, the caregiving staff, not the managing staff, required to take care of the patient for that 24 hours. So the core staffing, yes, FTE for the unit at the bedside. The core staffing for an ICU may not be the same as a core staffing for a medical surgical unit. A core staffing also will depend upon the day or the shift. For example, a core staffing in an OR where most of the surgeries are taking place during the daytime may not be the same as the night shift where only emergency surgeries are happening, the scheduled surgeries will not have. So from time to time, season to season, unit to unit, the core staffing could change, but that's a minimum number of staff that is required to keep your work going, to provide a safe quality care. The scheduling or the staffing or the roster data.
Hello.
All those, some of the words that you have used is like we all use that terms different in different parts of the world, is basically anticipating that how many staff you require or how much resources you need for that particular time period in that unit that you are managing. And scheduling is a talent. Those who are involved with scheduling knows that how much time goes into it. A lot of expertise, calculations, experience, and forecasting is required when you are doing a scheduling. So usually you see that scheduling is done by experienced supervisors, managers, nurse leaders. So those are some of the things that we just want to make sure that we understand. I just wanted to bring a little bit more into a little higher level of things that senior leadership look into is the workforce planning. I'm sure some of those who are the director and above level, like you're looking like, the higher or the up that you go in an organization, you have a better view of how to manage your service line better or your hospital better. So that's a process of anticipating or forecasting what kind of workforce you need for the particular service line. For example, for your intensive care unit, you need highly skilled people who are working with, intensive care skill sets that they need to work, or neonatal ICU. So you need a specific skill set for that. OR staff, specific skill set, or medical surgical, older patients. So depending upon labor and delivery, midwifery skill sets. So depending on that, you have to plan. At the same time, I put some notes here for myself that process of forecasting the staffing needs to provide optimum quality care and operate with maximum effectiveness and efficiency. So one of the example is that when you're planning your workforce, you do not want to put all new staff in one shift. Sometimes what happens is some of the organizations, and when someone is joining, they have to first go on night shift. I believe in most of India, I see that there is a permanent staff, part-time staff has emerged during COVID time, forecasting for future and contingency plan to meet emergencies. So thank you for putting that in the chat. Yes. So if you are hiring, say, new nurses and they have less experience and they all are working in the night and emergency happens. So we do not want to have the new ones. New could be even experienced nurses, but when they are in the organization, they're new, they're not aware of all the things that's happening or the resources where it is. So we do not want to throw them under the bus for a disaster. So these are some of the things that you need to look into while you're planning the workforce planning. And healthcare economics is entirely a major field or a study field that look into the overall management of healthcare, not only from the staffing perspective, but not only from the resources, but how insurance works, healthcare resources, what are the things that you require in the healthcare management. So these are some of the terms that will help you to understand that staffing is not just one shift that you're managing, but you have to look into a lot of different things. I found this an interesting that article that I thought I wanted to bring it to. This was published in the Personal Psychology about surveying the forest. Surveying the forest doesn't mean that you're looking at the turnover rate from a bigger picture, like overall, from a bird eye, because like a bird, the higher you fly, you get a bit of bigger picture. So when you are looking into turnover, we'll focus on turnover because let's focus on one issue, right? Turnover is kind of a clear picture of how we are able to keep our staff in our place or not. So when you are thinking of turnover, where are some of the places that you need to look? So this study has gotten some meta-analysis. We have got a great result. You can go into this article. I just put a list here that I found on Creative Commons. I thought this would be interesting for discussion here, that it tells us what the turnover rate is. So identify your turnover rate for your organization. Some of you, those who are in senior leadership, right away, you know what your percentage is. Look at your turnover rate for quarterly at least, or for the last 6 months, what was your situation there? And how that is affecting, and how does it look like to the similar healthcare system across the nation? You want to compare the benchmark to see that are we doing good or is it a global problem? We have seen some of these situations, and that's how we know that staffing is a global issue now. How is it distributed? Is it located to certain job category? Is that the OR nurse is constantly leaving? Or is it because the way we are recruiting? Or is it, sometimes you see the similar unit, but people do not like to work for one particular manager. So anyone who is coming to that unit, they do not like that manager and leaving. So is that the person's management style? So it's interesting to look that many things are there that affects the turnover rate. But you want to look at your organization's data and compare it with how we are comparing to others. And also what are some of the things this turnover is affecting you? Is it draining your engagement? Is it draining your resources or your productivity, or how you're giving care? Is it raising your your incidents are going up where where patients are taken care of? So lack of transparency among healthcare players, yes, those are some of the challenges that you see bureaucracy, we see that happening, and that affects people. Are smart people, know when an organization is a good place to work or not, so they make that informed decisions when they decide to work for an organization. So gone are the days that someone a higher authority says and people will listen. You don't like that place of work, people know, especially nurses, if I leave here within a week or so, I'm going to get a job on another place because there is so much need out there. So this is some of the latest data. I got it from the tonal conference that I attended last month. And this is the data from the PSAW that says average nurse turnover rate here in the United States is 27%. And can you believe one nurse's turnover cost for an organization is 46,000. A rough estimation is like 1 times to 1.5 times of salary. Annual salary is the cost of replacing one nurse. So look at the drainage of the resources or the time it takes to get an experienced nurse, 7 days to get an experienced nurse to replace the nurse who has left, if that's an experience. So that is a big issue. That's a big issue. And some of the impact is also on the patient. Not only it is on staff or the finance, but also on the patients. Like the things that gets affected is because the care is not given in a timely manner, so we can have increased length of stay. The patient care is more now. And as nurses, we know that nursing care is not given to the full extent. What will happen is nurse sensitive indicators are affected. So nurse sensitive indicators are the outcomes that's directly related to nursing. For example, fall rate, happy you call happy there, we call happy here, CLABSI, C-diff, and this is some of the ones that's directly related to the nursing. And it impacts the satisfaction. It impacts the satisfaction. So overall, all these things is going to impact safety, quality, and consumer satisfaction. Consumers include our staff. Consumers include our stakeholders, the patient and families, and everyone who is directly or indirectly connected with healthcare. So what's this big why? The big why we all are so concerned about staffing, the staffing challenges. The bottom line is that if we are short-staffed, it's going to affect, number one, our safety. I do not want to go or take my loved one in an organization where they do not have adequate staff, because that means we are not going to get that good care, right? So the patient safety is the number one concern. Second is the quality of the care that you're going to get. So something that needs to be done in a good time, people are rushing and things can be left. Surgeries are done in a hurry because there is not enough staff, no one is counting, or shortcuts. We start taking shortcuts. So patient safety is affected, quality of the care is affected, and consumer satisfaction. I always tell that we have to think that happy staff they are going to be joyful and define meaning in taking care of others. You have a great team, you've got an engaged, motivated, inspired team. That team is definitely going to take care of your patient well. So always think staff. Sometimes there is a book that I read about, your staff should be the first. Sometimes we see the patient is first, or the consumer is first, or the customer is first. But you have to make sure your staff is first taken care of. And all these things affect us as nurses. And nursing is a profession. You know that it's a profession. Largest health care workers are nurses. And we are our own discipline, a scientific body of knowledge, skill, critical thinking. All this is involved for us to do our job well. And we have to be the voice. We have to take over or take care of our issues. Not someone else has to take care of our issues. So that's one of the most important things I feel as leaders, as nurses, we have to be advocate of our profession. And some of the things that we need is that not only we are filling a number by one staff. That's not a number. That's a person who has got the skill set, the knowledge, has gone through a body of learning and professional course to become a nurse, has a license to practice. and constantly growing to keep up with the knowledge and the technology that is out there to give the care of the patient that's committed to them, right? So not only we want to keep the staff, we want to retain our high-performing staff. So that's very important. That's very important. And that's one of the biggest challenge and the trouble that we are facing. And let's come to some of the facts. And please feel free to add. This is not a comprehensive list. I just read some things and put all those things in a collective form here, but feel free, I categorize under 5. And let me see the chat. It says, yes, when staff feels cared for, the attachment to organization increases and may have impact for retention. Definitely. Thank you, Anjali. You're right about that. And look at all these things that, yes, a lot of the global issues around staffing are common, but since we're mainly talking about Indian scenario, I thought of like bringing some of the specific things that affect us as Indian nurses. So the organizational administrative challenges are the patient work, so many hospitals have popped up, but all of these hospitals are almost always full, especially in the urban area. And we have seen an increase in the elderly population. Isn't that true? Lack of resources. This include not only the staff, but also the equipment or the things that you need to do a good care. You have all this knowledge and the skill set, but you do not have the time, or you do not have the things to take care of the patient. Some of the government setup that's what the challenge is. Some of the nurses say that. Technology is constantly changing. So for some, that is difficult. Some administration is on top of getting the latest technology in their organization that benefits the nurses, some are not. So are we affected by that? Then it's also where that organization is situated. The rural challenges are different. The urban challenges are different. Smart customers and fluctuating census, definitely, everyone has information on the fingertip now. Those who are educated, they are able to question. We call that Google doctor, right? Anyone can go on to Google and find their diagnosis and even the management. And if we are not doing according to the expectations, they are asking or challenging us. So that requires, as professionals, for us to keep up with the scientific knowledge, not the general knowledge out there for any public or the lay person or the Google, but the scientific knowledge. Some of the personal challenges are seen is that challenges around motivation. People are not motivated, engaged. The staff also have issues around the management. The management has issues around staff, and this affects the job satisfaction, both for the management as well as for the staff. Then a big issue in India is also about our personal status. The challenges for single person is different, married person, gender, like if you're a woman, the security issues. Sometimes when I remember when I was working there, some of them were not comfortable working night shift. They did not find that safe. So what kind of an environment we are creating for our staff? Are they finding it safe for them to work? And not having enough compensation, that is very tough. Yes, very, very good about that. And that's what I put in the professional challenges that India faces. A lot of inexperienced staff. I have been told by executive leaders there in India through some of my professional organizations and the contacts that I have is that we get a lot of inexperienced staff. And there's also an educational gap. Some are coming from these great organizations with a great training, but we also get staff. They have the license, but they don't have the training. Some of the nurses are trained. They never seen the patients in real setup. They have practiced on a dummy, and here they are thrown into working with the patient. And during the COVID, we had a big batch of nurses who had simulation labs who never got to touch the patient. And when they are coming and taking care of the patient, you see that pay parity is huge, especially with other professionals. Here in the US is the gender pay parity that you see that, in nursing, you don't see that much. The gap is much closing, but other professions, the male administrators or the leaders are paid more compared to the women. But in India, what we see a significant, huge gap between the professionals. and nurses are equivalent to any other professions. We are professionals, but the pay you do not see getting paid. Numbers versus competency, exactly. The competency is a big challenge, and whom to blame for that? So I see some of these challenges are very real. Then on top of that, we have a very complex socio-political environment. The professional stigma. Growing up, I knew even my classmates, some of them were ashamed to tell that they were nursing cadets. We were called nursing cadets. So we went to school along with the medical cadets. And so people who do not know, they will say we are from AFMC, but we are medical cadets. So I was thinking, why do we even have to have that kind of a stigma that I cannot say proudly that I'm a nurse? So is that the social stigma and the gender stigma? Because most of the people who are nurses are females. But again, most of the nurses that we see is from the southern state than the northern state. Some of the religious factors, because some religions and castes do not consider it good for female to touch a male or a guy, or touch the body secretions, some religious effects. So this doesn't allow a lot of people from certain sects or area, or so that's kind of a problem in India, right? Like a lot of people who are talented or may even want to do in the service mindset of the profession, not going into the nursing profession. In fact, I got to see a book, it's just missing my mind, like about the Kerala nurses working in Delhi. A study was done. If anyone knows that book's name, please put that in the chat for others to see. Even you can Google that. So these are some of the things that we see that is very particular to our Indian nurses situation. Why we are having that? The professional recognition is not there. The role expectations are varied. Even the licensed registered graduate nurses are expected to be in certain parts or certain organizations or hospitals, even now to be like handmaids of doctors, like whatever they are doing and saying that they are going to do. I remember one of my far distant relative in a nursing school, and I was saying, hey, so how is everything going? Like, have you learned how to do IV? And oh no, and that person's a second year student and she has not even started with IV or IM injections. So I said, like, oh, we follow the doctors, and I mean, taking towel for when they wash their hands and wiping the towel. This kind of education, what are we doing to our professionals here, right? So these are some of the thoughts that we need to look into. Are we still keeping those kind of practices? Who is speaking for these students? Who is going to talk for us, for our profession? So that gap is huge. Nurses who are mothers don't want their kids to be nurses. That's kind of sad. Here we proudly say, in fact, I wanted both of my kids to hear they are not they're math-minded, engineer-minded kids. So I wanted to influence them. I said, like, this is one of the best professions, so much opportunities. You can do anything with nursing degree, but it's entirely different here. This proudly, we tell everyone we are a nurse, but that's a little different in Indian setup. So is this a problem? Is this, we have so many people out there who want to, but they are not able to go to profession because of that kind of some kind of the socio-political pressure or the society they have grown up. And one thing that bothers me the most personally is the professional autonomy. I would not say that there is no challenges in this Western world. There are a lot of challenges. Life has got its own challenges everywhere. But the one thing that I feel proud of is that the professional autonomy that I experience here, and that's what we lack. Look at the amazing talents who have joined here with us in this session. Such great minds, such educated professionals, such great leaders here. But we proudly say that we have the professional autonomy as nurses in India. Nursing doesn't experience that professional autonomy. So that's another an issue that we have. Then the globalization. My God, that's the biggest problem. I feel that most of the private sector hospitals face is that people are coming, gaining some experience, and their ultimate agenda is to go to a Western country. Why that is happening? Migration is happening because for better life, their opportunities are better. We call this the glitter of westernization, because you see all these things, that images that is in your mind, and to a certain extent it is true too. And what it is doing to our profession is not only the brain and professional skill drain, but we are losing such talented, skillful nurses that we are training on our soil to others, including me. Like, it was a long haul for personal family reasons. I got to move, and for a long time I had that guilt, like I got such great training and I'm leaving my country kind of a feeling. But now I transformed that to making kind of a, like a reaching out. So this is one way of mine to reach out, to share the best practices, thanks to the time that we live in. The technology helps us to do that without traveling anywhere, right? So these are some of the great challenges, and thank you for putting things in the chat about the detractors and nursing head positioning in organogram. Yes, having that visibility, having a seat at the table. We'll be talking about some of the solutions, what we can do it collectively together. Let me keep a track of the time, how we are doing with the time. So some of the things that when we think about the innovative thinking, I wish we had a magic wand to solve our problem. But some of the things that come to me as a person, as a leader, is some things that we need to learn from one another. But we have to be patient, that this is not a fix. This is a slow and steady process, trying one thing at a time and sustaining, and then move on to the next and implement it. So for that, we need to understand the problem. What is that unique problem pertaining to your organization? Few of that, prioritize that to understand that problem for your organization. Understanding the need of the staff. What do the staff want? We'll look into some of those details coming, and also explore the available resources. You cannot do with great ideas if you do not have that resource in your organization. The problems are different, the resources are different. So what works for the Western world may not work for an Indian setup. What works for Indian government setup may not work for a private setup in an urban hospital versus a rural hospital. So these are some of the things we have to keep in mind. We have to think out of the box. We have to think out of the box. And when we say think out of the box, it means that we have to advocate constantly for safety, quality, and satisfaction of the staff, as well as satisfaction of the patients, consumers, family, all the stakeholders who are coming into our organization. Look into some of the innovative staffing models others are adapting. I saw that, the permanent shift, or shift, 8-hour shift, 12-hour shift, weekend shift. Can we cater to the need of the staff? So we'll look into some of those innovative models. In fact, I'm also involved in some of the innovative care delivery models, and we are looking into virtual aspects and different kind of models, because staffing shortage is a huge problem here too. So what we were working, the primary nursing care models or the team nursing care model. So these are some of the models out there people are adapting. Is that going to work? And it's very important that we implement some kind of field research in nursing. Researches happen in nursing field a lot in the academic area, people who are doing masters in nursing, PhD, but you do not see field research happening. We do not have nurse researchers in a lot of organizations in India in the clinical setup. Do we have a nurse scientist? Can anyone put there, do you have a nurse scientist in your organization in a clinical setup? I'm not talking about academic. Do you have a PhD prepared nurse scientist working on nursing research in your organization? Anyone? We have. Juliet says, can you tell me which organization that is, Juliet, please? I'm really happy to hear that we are. Apollo, kudos to Apollo. Kudos to Apollo. And Apollo is one of the organization at, global organization at par with any other. So that is amazing. But can everyone afford to have one of the nurse scientists? And they have published articles in journals too. So we need to have researchers, nursing researchers, not a nurse helping with the medical research. These are the scientists, these are the nurse researchers who are looking into the specific nursing problems affecting patient care, affecting the staffing. Then we have to have some kind of partnership with others, not only nurses, but nurses with academic setups, nurses with interprofessional team members, how we can improve staffing. And also we can look into some of the tier level staffing to meet staff and patient needs. I just put some things that under different category, and that's what I thought we will go. And if this is some of the things that you are already practicing, please put in your chat and maybe your organization's name too. So that way others who are attending will be able to reach out to you for some practical tips. As I said, like we have to, number one, study our organization and the community we serve. Who are the people we are serving? So these are some of the things that we're focusing on to meet the current needs. If you are in an urban, and if you are a corporate organization, or if you're a government organization, what are your challenges? What are your resources? Know your organization, know your challenges, then partner with others. So one of the examples I put in here is partner with local nurses. A lot of organizations have their own nursing school, so you get some kind of a nursing staff filled from the senior students who are able to provide, good nursing care. So you do not need that many of registered nurses to take care of the patients. So one of the mod, like in an organization, I know that the top 10% of the nursing students passing out from that organization will be automatically recruited to this organization of one. So that was one of the partnership model that I have seen. So look around. If you do not have a nursing school attached to, can you partner with? I'm sure many of you are already doing that. Then one of the other things that we have seen working more and more here is develop your own internal float pool. So what I feel that if you have a group of nurses who are there for a short time, have you thought of creating an internal float pool, a separate department run under by a director or a manager or a head nurse, however you define the leadership position? They have a float pool. They can be paid per hour. And for say 4 hours, 6 hours, 8 hours are also overtime. And this way you are providing a great experience opportunity for a nurse who's there for a short time, at the same time an opportunity for them to make money. So for someone is there for 1 year and they want to gain some experience, go to another country, you cannot stop this. That is a reality. Whether you like it or not, people are going to say pass through. A big chunk of people are going to make your organization a pass through. But how can you make that pass through a great experience to your benefit? These are some of the ideas. Clinical ladder. I'm sure some of you have the clinical ladder. I see campus interviews put there by Raj. Yes, campus interviews are a great way of recruiting. And once you have them recruited in your organization, to keep them there longer, do you have a level system? So for example, level 1 could be the entry level. Once they complete to the 2-year mark, they could be level 2. So increasing the salary or opportunities, 3 to 4 add-ons, however you want to define them. And as you're going up there, their facilities, their levels, their tier, their experience, expertise, and benefits go up. So that is one way. And we have clinical ladders here in many organizations, especially if it is a magnet organization. These are some of the standards that you need to maintain, because these are known to be working well. The magnet accreditation shows that the 14 forces of magnetism that shows effective and the best nursing care. Magnet Hospital brags about providing the best nursing care and best nursing outcome. Then also I would say that instead of playing the blame game, support the person and the professional that's coming to your organization. If they say that they are aspiring in 2 years of time, they want to go to UK, US, or Australia, it's okay. Everyone is looking forward to have a dream life of theirs, whatever that may be. If you give them that support, yes, we are here to support you. However time you are here, it's a take and give relationship. So make sure that we are there supporting them instead of having that animosity feeling that, oh, you are here only for 1 year and you're going to leave. So we are not going to, support you. And then, people understand. People, that interaction, people say to know that how each other feel is it only takes 7 seconds. When you interact with one person, that vibe of positive or negative waves, we can right away get it. So some of you have, so as Jyoti said, that we do that, it helps. Yes, it definitely helps. And adapt and use the technology to your use. There are a lot of apps people are using for signing up for extra shift. And whenever you're calling people for extra shift here in the US after 40 hours, because nurses are, other than you are in a salaried position, leadership positions, clinical staff are hourly. And sometimes not sometimes, a lot of the times, the clinical nurses, we say the lateral growth because of this clinical ladder, that they end up making a lot of more money than the leadership sometimes. You are coming every hour, you're making money. More than 40 hours, you're making time and a half, so some of those benefits need to be inputted in there, and using the technology, using an app. Teams in the Microsoft is a great platform to be collectively use simple things, like people are using Excel sheet on Teams to sign up for extra shift. So use the technology that you have to your benefit. Then very important is establish a professional culture of excellence, using the facts and data, not feelings. When you are even going to do a performance review, you have to do it according to the behavior and the facts and the data collected, having a running journal, not because you feel something for a person. So teaching that to everyone, even for interacting with other professionals, even for interacting with the patients, the families. Are we preparing our nurses for conflict management? Are we preparing our nurses for service recovery? So these are some of the skill sets that we need to consciously look into for a profession of, for a culture of excellence in an organization. Barcoding for drug administration, yes, a lot of the organizations are using that successfully, and that saves a lot of time and automatically, charts that the medicine has been administered. Some of the long-term planning is that you can get from some of these ideas, but if you are doing something innovative more than what we are mentioning here, please put it in the chat for others to see and for me to take notes too. So professional development opportunities, again, you can have it like a tiered way. In the sense if you spend 2 years here, you will now be able to go on the expense of the organization for a conference. Or when you are here for 5 years, now you'll be eligible to move up to a leadership position, take up a leadership course. Tuition reimbursement, like if you're here for 2 years or 3 years, you can go for your higher education or some short courses, and organization will pay. And some of the organizations here use a retention bonus and experience bonus. So those are incentives that can be used. And recognition, celebration. Are we celebrating our nurses? Nurses Week is coming. Do you have plans in your organization for celebrating your nurses? Or do you have special awards? UK has a tendency not to give much awards. UK's healthcare system is also government, social medicine is what they practice a lot, is what I come to know about. Whereas here, it's very competitive, more of a private sector. Here's a lot of effort and money is put into rewards and recognitions. There is a lot of accolades and applause systems. We have electronic applause systems. And some of the point value system even accrues money. There's a monetary value, like you got this many applauses, you're going to get this much money to it. So think of these innovative ways to how you can improve engagement, motivation. And this is exactly what we're talking about, seat at the table. Senior nurse leaders should have a seat at the table in the executive table. Especially a CNO should be at par with the CMOs. Chief Nursing Officer should be at par with the Chief Medical Officer. So it's not a medical officer or because of the doctor degree, and why not a nurse is having, because nursing is a profession. We have doctor prepared nurses in our profession. Why? And we have so many CNOs who are doctorate prepared, PhDs. I know many of group directors who have got PhDs. So they have that knowledge and the skill set. Why cannot we elevate? Have some criteria like, okay, like, putting and building into that. But having a seat, take your seat at that table. Make sure that you use your facts and your data to support that. The decision around nursing, that's 70% of the staff in my organization, and I am in charge for my staff. So the decisions, I need to have a voice. I need to be the representation. It may not go well all the time, but it's a time for us to speak for ourselves, for those organizations. I know many have already doing that, so that's perfect. That's really perfect. Some of the things that will also elevate and keep your staff engaged and keep in place is your accreditations, both at the professional level, like certifications, and at the organization level, like the Joint Commission accreditation equivalent to that in India. Many have been speaking to me from India, Indian executives, about magnet status bringing to India. So I'm really excited about innovative programs that you have. And why don't you think about a position like clinical excellence program manager who work hand in hand with the chief nursing officer, so that the chief nursing officer is not constantly managing at the same time looking for innovative ideas. What I call is, my role is more like preventing fire. An operational leader's role is putting off fire. Those are two different roles. Someone has to constantly think about preventing fire, look into literature, look into best practices, get what's happening around and what is going to work for the organization to do. So creating a position like that, some of your organizations, high performing organizations, may be already having that kind of the role. So I feel like those are some of the ways that you can promote some of the challenges that you're facing with the staffing. Promoting EBP, nursing research. The evidence-based practice is one of the best way, and I'm a proponent of evidence-based practice because my doctorate is in nursing practice. I consider this nursing practice, DNP is prepared in the United States, especially for the clinical nurse leaders, to bridge that gap between knowledge and practice. Patient prepared nurses are very research oriented. They are always doing research and finding this knowledge, but we are not able to bring that to the frontline level. So the DNP prepared nurses are able to identify these evidences and bring it to the frontline, and the knowledge is already there. The skill is already there. The best practice is already there. All you have to identify that best practice, match with your problem, find an intervention that's suitable for your organization. Above all, I would say that each one of us, if you have chosen to become a nurse, be proud of that and be proud of who we are. And any nurse who's coming into our organization as a leader, make them feel welcome, make them feel that they are in a profession that is one of the most noble professions in this world. And these efforts are not going to happen just by few nurses or few nurse leaders or the entire, sometimes not an entire nursing fraternity too. We need a multidisciplinary approach. As we have that multidisciplinary approach in our patient care, we need that multidisciplinary approach for our staffing challenges too. So those are some of the things that I feel, and yes, success is possible, hope is out there, and success totally depends upon the collegiate work, the educated work, the informative work. You have to constantly learn and develop to know that what is best out there. Until we read, until we go for literature search, until we make ourselves, aware of the things that is happening out there for us to bring it to our unit. We cannot do that sometimes all by ourselves. Have you thought of joining hands or getting some people or folk on there for one project? Hey, can you do some literature search on that? So those kind of the things, that is what will work to make an impact. For that, we have to own our profession. Then others will value that we are not talking just based on our feelings, but we are talking based on the facts that's out there. That's how we become confident talking to other interdisciplinary team. They will value our input. That's how we find that seat on the table. then we take part of the shared goals. You need to know what is the mission of your organization. You need to know what the vision of your organization, the value, what are the strategies your organization have in place, what strategies are affecting our nurses. Is our role very clear? Do we have that mutual trust among doctors, pharmacists, therapists, and nurses? Do we have an effective way of communication with each other? And any processes that we have in place, are they measurable? Or the outcomes that, are we measuring any outcome? We are implementing something, what outcome we are measuring? And always think about the consumer-centered approach. Remember, consumer is not patient or family. The consumer, number one consumer is our staff, each one of us and the people who are working directly and indirectly with us. So I like you to take something. I know we discuss a lot, but what can I, as Viji, or say Anjali, Jyoti, I'm seeing some of these names out here, can take from this session? I would say just know this to take with you. And because acronyms is one way that I remember things. And you have to know how to get things done. For that, you have to know about yourself, what your capabilities are as a leader. I'm talking from the perspective of the leader, what your strengths and weaknesses are. Do you know about your organization? Do you know about the current trends of staffing challenges or of your profession out there? Start looking into it, because not everyone can do anything. Not everyone has a passion for everything. Not everyone has the bandwidth to achieve everything. So try to find that and know your organization and all that things a little bit more. Second, I would say is networking and partnering with others. Look at the networking that has made this session that's possible. I've become very good with this kind of network, because talent and what works best always attracts me. And I get myself plugged to an organization. I'll take membership as much as I can possible. Like, you can only spend so much time in getting things done, right? So network, see why that organization is doing, what is that thing that we can adopt here? See that leader who is doing something, what is that she does? I want to adapt. I want to be like her. Identify mentors. Not even a single person will say, in my experience, I've reached out to so many people that you identify that you want to emulate. They always welcome you and teach you things. And that's what a true professional does. Then you know that we have to constantly think out of boxes. Look outward for ideas. Don't only look inside your organization, but look outward. For example, I'll give you a big example of shared governance or professional governance that came from an automobile industry that we are practicing in healthcare. Toyota is the one who practiced shared governance first. And I'm a big proponent of shared governance, and now we call professional governance. They reach out to the staff for solutions. It's not the boardroom executives made the decision. And that's what we are doing here in the healthcare. We constantly reach out to the front line for their opinion. Gone are the days when the leadership and the executive level are making this. We have to meet somewhere in between for the problems that's affecting the front line to have their voice in. And largest front line is our nurses. And then constantly work yielding an outcome with a purpose, with a plan in you. So working towards it, but you have to adopt a model. You have to adopt a quality model, you have to adopt an EBP model, or you have to adopt any research. But with that purpose, plan, and outcome. Why do you think the medical profession is advancing so much more in India than the nursing profession? They're constantly implementing a quality project, learning, making it possible in the unit. They're publishing it, they're presenting it. But as nurses, only I would say that only a handful of people are doing that. Very passionate, or a few percentage are doing that. So this is what I feel like you know what you need to know to make your problems. So with that, I would like to conclude finally that yes, hope. Yes, there is hope, because leaders who face the challenges with hope are the ones who are successful. They may not see the results immediately, but you will see the results as the time comes. I would like to have one volunteer. This I have shared. Some of you might have any session that you have attended anywhere that when people tell me that I cannot do, I love to share this story, the Starfish story by Lauren Isley. And many of you might have read this already. I would like one person to unmute this and read it for me, please. Anyone?
One day, a man was walking along the beach.
That's what I told her. But she's telling us.
Hello.
Yeah, go ahead. Yes, go ahead, please. Sorry.
Can I, ma'am?
Yes, please go ahead. Your name, please, and where do you work?
I am Bhagya from Manipal Hospitals, Vijayawada.
Oh, very good. Yeah, go ahead, Bhagya, please.
Okay. One day, a man was walking along the beach when he noticed a boy picking something up and gently throwing it into the ocean. Approaching the boy, he asked, "What are you doing?" The youth replied, "Throwing starfish back into the ocean. The surf is up and the tide is going out. If I don't know, throw them back, they will die." "Son," the man said, "don't you realize there are miles and miles of beach and hundreds of starfish? You can't make a difference." After listening politely, the boy bent down, picked up another starfish, and threw it back into the surf. Then, smiling at the man, he said, "I made a difference for that one."
Thank you. Thank you so much, Bhagya, for reading that. That's exactly. We cannot change the entire nursing problem or the staffing problem, but can we change one thing, or can we retain just one nurse? Even if you're a staff nurse or a clinical nurse or a mid-level nurse manager or a leader, if you are able to influence one nurse or a few of that or something that you implement in your unit and able to retain or able to help us fellow nurse, you have made a difference. So that's all I just wanted to tell you. Thank you for being with me in this journey of learning. And we would like to hear a little bit more. And thank you, Cygnia, and thank you, Ms. Gomez, for this opportunity for being with you all. My contact is here. Please reach out to me if you want to share some of your ideas so that we all can learn together. So thanks a lot. So it's now open for anyone to share anything, any innovative things that is affecting your unit. So I don't want to hear the problems. You all know the problems. I want to hear, what are you doing to solve that problem?
Thank you, Dr. Viji. Thank you so much. It was such a enriching and out of box discussion, and I'm very sure that as people are listening to this, either they are already doing something or they are already coming up with some ideas that this is what I'm going to do. Even I have noted it down, though I don't work in any particular system, but I can very well imagine the stress and the pain that nurse leaders go through and what is required in today's time. So just from my side, I just happened to ask ChatGPT is very famous now, right? So I went and asked ChatGPT, innovative staffing solutions, for nursing. First thing the ChatGPT gave is technology. I really want to shout out to all nurse leaders that we should not hesitate in embracing technology. Somewhere, we tend to have this fear that if technology comes, something we are going to lose from nursing. We are anyway losing nurses. So maybe the technology should be leveraged to retain them. So that another thing that somewhere you mentioned is that the nurses should perform at the top of their license. So it's not very easy. I would like to behave like the boy in the story. At least if I can throw one starfish back, I'll be very happy. So today, if out of all the almost 250 people we had, even if one of them go back and try to do something very different today for the benefit of these staffing issues that they are facing. And one last thing that I would love to advise to the nurse leaders have been there is that in India, specifically, something you told towards the end, use your measurable outcomes, facts and figures to argue for patient safety. Don't cry for nurses. Nobody's going to listen. In India, nobody's going to listen. But cry for patients with facts and figures. The nursing safety and nursing benefits will tend to get addressed. I wouldn't say it's a one magic bullet for everything, but this is just my personal experience where I also went through tough times, but not these times. This is very, very different. The attrition levels of 50-60% is unbelievable. So the challenges they should be facing would be tremendous, because US, when you were struggling with 2 and 3% attrition, in India, we were at about
No, it's not 2 and 3. It's
and
not
now
2
it has gone higher. So now yours has gone higher, ours is even higher. So that's where we are. So we have Captain Sandhya, who is the group nursing director for Fortis Group of Hospitals. She's on the video already. So Sandhya, over to you for your comments and any questions.
Thank you, ma'am. And Viji ma'am, thank you. I'm so glad to see you again after a little gap, short gap rather. But as usual, I say I simply feel proud of you and, equally enriched and, super excited after listening to you. And, it's simply wonderful. Few things, from my side. And it's just something which worked for me. While we boast of being the one of the accomplished healthcare organizations, and there are many more in the country. As in hospital, every hospital which is a tertiary or a secondary setup, and because those are in abundance in the 74% of the private sector in the healthcare sector in the country. If we think of adopting at least one institute of college or a school of nursing, we will certainly accelerate the pace of quality of education and the quality of products who are coming out, because we are the end beneficiary of the products which come out from those institutes. Doesn't matter, nurses move to greener pastures, but before moving to greener pastures, they come to us. So, and this is what actually almost 2 years back, I thought that we should stop complaining because it will take time for the education system to revamp. It started to happen. The needle has moved in the country now with the budgets and other things. But this is something which will work for us. And few of, very thoughtful nursing heads in the network, in my network, have gone ahead and done this, started to make difference. And the word spread and the more institutes came forward. So probably, if all of us take this initiative but in a very thoughtful manner, and it has to be professional, respectful, and mutual, and giving a feeling of mutual win-win. So this is one thing which is required. Second is focusing on the students when they come to you on inculcating professionalism, because if we see all the points and bullets here, inputs here, there's underlying thing which is missing, and everybody is actually trying to say is professionalism. Setting the culture and setting the seeds for professionalism from their formative phase of nursing will certainly go a long way. And that's what the story of that boy comes in. Even a single nurse who knows how to conduct herself professionally will make a difference to the patients, to the colleagues, peers, doctors, everybody in the network where she is. So these two takeaways from the basics, from the grassroots, when we focus that we want to do it. And I think rest of the things, be it taking ownership or responsibility or advocacy, would certainly fall in place. But to start with, we need to start structured and start strong now.
Yes, thank you. I just wrote about, the people who are going to Western countries. One idea I thought of just sharing, because it just came to my mind today. Based on some of the professional support that one of the manager did in our unit. So in the ICU, what happens is a lot of the nurses in the ICU, they join for experience to become nurse practitioners or to become CRNAs, the certified registered nurse anesthetist. And that's kind of like they require minimum 2 years of experience in intensive care or ER. So instead of because she need to fill this ICU staff. So instead of they're thinking, oh, they're here for a short time, what she did is she started supporting them. And she told them that we want you to have your best experience here while you are here. And she helped them with their, the scheduling for them to attend their schools. So you won't believe, like, these nurses, as they're going out, they encourage others to come and join this IC because the manager is so supportive. So that gave me an idea about, like, if during the interview, ask them about transparently what your goals are, 1 year goal, 2 year goal. What is your intention of staying with our organization? What is your end goal? Are you looking forward to go to UK, US? If you think of more of your organization, more of the nurses are coming, passing through that way, put in a program. Why don't you put in a program like spoken English classes for which people are spending so much money outside? Having an organization come and do that for your staff. If they complete 1 year, you can give 50% off for that class. If they complete 2 years, you're going to do 75% off for that class. If they're completing 3 years, you're going to give them, absolutely free. So here are some of the ways that will keep, okay, here I'm going to work for 2 years. I'm going to get experience and this course and some professional, I called it as a professional grooming because I worked in a staff development for a long time in Kuwait. Usually a lot of nurses from all over the world came, and one of our responsibility was that professional grooming. Not only the appearance, it doesn't matter, the grooming doesn't, yes, that matters too when you're a leader or when you're a staff, that crisp, clean. If you are a healthcare worker, some of the things are expected of you, or the way you speak professionally, right? It's not only English, the way you speak to a colleague. It's not like how you're talking at home, right? So those some of the things that can be taught. So how can you incorporate that? And people will value that because no matter where you go in the world, that professional behaviors matters. So some of these are some of the innovative things that you can put in your organization to attract and keep. And who knows that you will end up having them stay for longer because they say, oh, I don't even want to go. And we have this clinical ladder. I'm happy here. I want to be closer to my family. Trust me, it's a real sad situation. You have to leave your loved ones and your own country, migrate to another country. The charm goes after a few years, then you are stuck there. Money can only go so far. So to keep our people in our own country, that's the best. Thank you.
Thank you.
Thank you.
Fantastic.
I have a question to Sandhya for the sake of all the people sitting here. You talked about, partnering with educational institutions, getting the students to come to us. So there's a practical question that might come up that in private sector, will the patients allow students to touch them? And how do you work around that? Because that might be of use. Can I ask everyone to
Rosie Fernandez, can you please mute yourself? Yes, thank you so much.
Yes, so I thought for everyone's sake, they might be wondering, I would like to do this, but then what do I do with my HR and everybody else? How do I get the students to be there with the patients? That's the only way they can learn. And that's why you are giving them that opportunity. Thank you.
Thank you, ma'am. Thank you very much. And I'm so happy to answer this. Point number 1, and 4 things in this. First one, this was actually a belief. Jubilians, I know. Please, can you just mute yourself? Jubilians. Yeah, sorry. Ma'am, when I say 4 things, first one, it was a myth that in the accredited hospitals, we ask the students to come, and then we will be checked, we will have an observation, or our patients will not allow. Certainly, he or she, the student is not a registered nurse. And be it private or public, any hospital, unless until the skill is acquired and you have the license to practice, you should not make patients guinea pigs. The strategy here is define the role, take the curriculum, ma'am. When we study read the curriculum, there are so many activities which a student nurse can do independently in the hospital, number one, and match it with the job role of a staff nurse. And ma'am, every student can be tagged with one staff nurse or one staff senior nurse can have 3 students with that tagging. And moreover, because private hospitals are smaller hospitals, 300 400 bedded, not the 1000 bedded like public sector, so the students can be spread over the departments. Both the heads have to plan it, in such a way of managing the clinical rotation, and here not for 1 to 2 hours, which you said in the beginning of your question. The rotation should have at least that significant amount of exposure of a shift, so that bonding between the students and the registered nurses gets developed, and the students literally learn, and not only in the hospital environment, but also something related to care. So this is first thing. Second important thing is a professional conversation and an agreement between the nursing institute as well as the hospital. Third one is enabling the nursing institute to enroll the hospital in its teaching facility. It is a matter of pride also for both of them. So this is the third one. And fourth one, last but not the least, to collaborate and strengthen this. And as I said in the beginning, it has to be win-win for both. There can be or may not be, depending on the two, whether you want to be the preferred employer for those students or not. So between the institute. So, but with this, it is a very safe, regulation-wise, practice-wise, patient safety-wise, and as well as winning for skills and skill-wise, it is benefiting for everybody, the institute also and the hospital also. We have to work. That's what I'm saying. Ma'am Viji has been talking about this strategically, think and professionally and in a structured manner. So these are the things actually which we need to put in place when barring our emotions and feelings back, putting them at backside.
Thank you, Cynthia. Thank you very much. And I think the timing is right now. HR and the other senior leaders of healthcare, they will listen now, because the pain is felt by everyone. The pain is not getting better. So very important for nurse leaders, whatever out of box ideas that you have, please, this is the right time to bring it up and have the courage. I think Viji mentioned courage is very, very important. You should be willing to take risk. It is very important. And there's a saying, there is no magic that happens in your comfort zone. No magic. So if we continue to do exactly what we were doing, the results are not going to be different. So it is time for us to change the gear and probably get into something. And please reach out and talk to other nurse leaders. And these are all the tips that Viji has already given. And I did Viji, maybe these dialogues we will continue in other formats through webinar to see that more and more people can come and hear what are these out of box ideas, and that will also give them an idea to do something in their organization. At the end of it, we mean well for our nurses and we mean safety for our patients. These two go hand in hand. So I think, Viji, I will not like to keep you any longer than this. It must be now 1:30 or 2 a.m. 2 a.m. See, I'm so very thankful, Viji, for being here. Thank you so much. I wish, we still have, 184 people here that, they would like to maybe discuss and take more. We will create more such opportunities. Trust me. When I say that I will do, then I will do. So we will do something so you can come back and, learn from each other. And thank you so much, Dr. Viji George. Viji, I really love you for giving this time at the end of the day and staying awake. Many people will not do that, and it shows how much you care. And thank you so much for all the participants. So many leaders have come here. I can see a lot of people that I know, a lot of people I don't know. It gives me hope that we care. We care for our profession and we care for our patients. And with that hope note, once again, thank you so much to everyone. And thank you, Sandhya, for coming online and sharing your experience. Thank you very much for that. And all those leaders who put so many things in the chat box, Dr. Jyoti, Juliet, some people that I know, I'm just taking names. Thank you each and everyone for being here. And shout out to all nurses, all cadres and nursing students. Meet me on 17th, Friday at 3 p.m. I'll be discussing international patient safety goals. Not trying to teach you, but trying to tell you how to deliver those goals in your own role. So though it's 7 goals are there, let's see, I will try to make it as practical as possible. So see you on Friday. So thank you very much once again. And Viji, before you leave, last word from you.
Thank you. Thank you so much for your kind words, Tangam, and for organizing this. You are a passionate and pioneer leader. You made so much impact already. And so I know that this will continue. The fire has started. The fire has started. The profession is in the right track. We are in the right place right now. So all have to, hold hands together to move forward, not to stay stagnant, move forward with these challenges. It's our time. And thank you, Sandhya, for speaking up and sharing some of those innovative ideas. Please engage, when it comes from group leaders like you, people pay attention. So become that voice, get more like you out there to talk for each other. And once again, thank you each and everyone for taking time to be in this session, listening to me and sharing your thoughts. I've taken many notes for myself too, because you get to hear a lot of these things and we can, think together and make a small change, but in a larger way. Have a blessed day. Bye-bye.
Same to you too. Take care, Viji. Thank you very much. Thanks, everyone. Bye-bye.